Hi, this is Dr. Robert Antelak from the Gentle Dentist in Shelby Township. Our phone number is 586-247-3500. And the reason why I'm giving you that contact information is because after you're done listening to this, you're going to feel compelled to give us a call. What I want to talk about today is your cavities. A lot of people who surf the web are people in their 20s, in their 30s, and they're looking for a dentist. And I want to address you. Sometimes we have people in our office who come in, as I'm describing, and they have a lot of decay in their mouth. Cavities are kind of taking over. And what I want to do is I want to explain why that is and what you can do about that. Cavities form by bacteria that's in the mouth. That's that plaque that builds up on your teeth. That's bacteria. And when that bacteria comes in contact with sugars from candy, sugars from pop, then that will actually turn that, the bacteria uses it as a food source, as sugar, and it creates an acid. That acid, as it sits on your teeth, it basically rots holes in the teeth over time. And what I want to do is talk to you a little bit about what to do to prevent it and what to do to treat it. So the thing is that the bacteria that sits on there, if it's allowed to sit on there, every time you drink it, every time you have a sip, the pH, the acidity level goes up, the pH goes down, and that creates microscopic cavities. Over time, on the front teeth especially, the teeth might start looking a frosty white color. I use the analogy that frosty white color is like concrete that's been painted, and all of a sudden you start seeing that paint pull away from the concrete. Well, it's still painted, but now if you go through and you brush your hand across it or put something to it, you'll see it'll flake right off. That's what these white cavities are. The white ones that look bright white color, that's a cavity that's forming. Underneath that area, there's usually decay under there. So the most important thing right now is to learn about how to prevent it. I know you like your pop, but even though you like it, it's not good for you. Water is your best substitute for that. Water is really great because water is natural, of course, and it helps to neutralize those acids in the mouth. If you absolutely do need to drink, then what you want to do is you want to do it with a meal. If you have to do that, drink through a straw. The straw will not put the pop, the acidity in the pop itself, and the sugar on the teeth to create those cavities. Also, it's not healthy, actually good, to once you take your pop and to brush your teeth right away also. What that does is there's organic fibers in the tooth structure itself. When you drink the pop and there's acid, part of the minerals pull away from that. If you go ahead and brush it, those little fibers that are there will start breaking down. It will not reattach mineral to the tooth. That reattachment process takes place naturally between meals. Our saliva has the ability to what's called buffer it, to reduce the acidity level, and it also has the ability with minerals that are in the saliva to re-heal those areas that have been affected. So that's important. Also, using products with xylitol is helpful. Fluoride's helpful. There are a number of different products and ways to help remineralize your teeth so they don't become such an issue. And if it has become to that point where your teeth are hurting you, please feel free to give us a call. We will assess everything and see where things stand for you. But it's best to really prevent it if you possibly can. For those people who are nervous, we provide sedation dentistry, and then also with the gas. And so there's ways that we can help get you where you want to be. So anyway, if this describes you, please take the information that I just said and use it for your own use. And if you do need to reach us, our phone number is 586-247-3500. Our website is thegentledentist.com. Thank you.